Hello, everybody. My name is Jackie, and today I want to discuss with you guys the topic post traumatic stress disorder, or it can also be abbreviated as PTSD. In my presentation, I have included information that shows us causes, it shows us the effects of it. It talks a little bit more about treatments and coping mechanisms, any signs or symptoms that we should look out for, because I feel like PTSD is a very serious mental health condition that affects a lot of people depending on the trauma that they've been through. And I feel as if we have a better understanding of it, we can work together and help them with creating a support system or helping them come up with different coping or treatments that they can go through. As I previously mentioned in the first slide, post traumatic stress disorder is a mental health condition that can occur or be triggered by experiencing or witnessing a traumatic event. There are different types of traumatic events that one can go through that can lead to PTSD. Some of the examples that I included were assaults, accidents, wars, natural disasters, but there can also be other factors like sexual abuse, domestic abuse, like violence, that can also lead to the development of PTSD. And having this disorder can lead someone to deal with prolonged distress and can have effects on them long term. And if we put ourselves in a position where we are affected so badly by something that we have to deal with it long term, I would appreciate that somebody would give me information about any mechanisms or any treatments that can help me get through this. When it comes to who can be affected by PTSD, it can really happen to anybody and everybody. A mental health disorder like this one does not discriminate, but it does have higher risk factors to those who have experienced war, so like veterans or individuals with traumatic history that have dealt with abuse or violence. But like I said, this can happen to anybody and everybody, but they're most commonly found in them. And also, just another factor that we can also consider is that if somebody has been repeatedly exposed to traumatic events in their life, it can also lead to an increase in the development of this mental health disorder. When we talk about the history and the recognition of PTSD, we know that PTSD was officially classified as a disorder in the 1980s by the American Psychiatric Association, but the whole term of post-traumatic stress disorder has began way before that, and they would use it in referral to describe the traumatic events that the soldiers had experienced. So I have stated here that during World War I, it was referred to as shell shock, and during World War II, it was referred to as combat fatigue. But over time, researchers expanded their understanding of the condition, and they were able to associate that term with other victims who have experienced traumatic events. So they were able to broaden their view, and a lot of people were also able to relate to PTSD. Signs and symptoms of PTSD can vary between the person. There are some people who have better coping mechanisms when it comes to this mental health disorder, but there are some people who actually struggle when it comes to it. But there are four main signs that one can look out for to know that somebody is going through that mental health disorder. The first one is re-experiencing, so just seeing them like when they have their flashbacks or nightmares or any intrusive thoughts. The second one is avoidance, so steering clear out of reminders and trauma. The third one is negative changes in mood. So when you see somebody in an environment where they just have that kind of detachment, that can also be a sign. And then the last one is any arousal and reactivity. So like I said, if someone being in a certain environment and the way that they react can really show PTSD. There are various treatment and coping mechanisms that one can go through. Everyone does respond to trauma differently, so it can take various coping mechanisms to help someone overcome this mental health disorder. But some of the most common coping mechanisms can include therapy. So we have cognitive behavioral therapy that can challenge the negative thoughts. There's medications like antidepressant and anti-anxiety drugs. And there's also lifestyle adjustments. So one can get into meditation, exercise, or support groups. It all depends on what works really best for them. In this slide, I have included a video that provides a real world perspective on that disorder and kind of goes over everything that I have listed. So if anybody wants to get a further, better understanding on it, you guys can go ahead and watch this video. I have also included references in case anybody wants to go back and read about this topic and have some valuable insights of it. And I hope that you guys were able to get a better understanding of what PTSD really is. And yeah, thank you.